Welcome to today's pharmacology quiz on TCA antidepressants, part of our ongoing pharmacology quiz series. In this video, we'll test your knowledge of tricyclic antidepressants, drugs commonly used to manage depression, anxiety disorders, and certain chronic pain conditions. The quiz features 10 multiple-choice, scenario-based questions to challenge your understanding. Each question includes 5 options, followed by the correct answer and a clear explanation. There's also a companion video offering a comprehensive review of key concepts on TCA antidepressants. Its link is available in the description below. So, let's get right into it. Question 1. Mrs. Fletcher, aged 67, with a history of chronic neuropathic pain, has been maintained on nortriptyline for 6 months. She presents with dizziness and orthostatic hypertension. The clinician considers switching therapy due to intolerable side effects. Which of the following TCAs would likely produce least sedation and fewer anticholinergic effects in this elderly patient? Option A, amitriptyline. Option B, imipramine. Option C, nortriptyline. Option D, desipramine. Option E, clomipramine. The correct answer is option D, desipramine. The explanation is that desipramine is one of the least sedating and least anticholinergic tricyclic antidepressants, making it a safer option for elderly patients. It primarily inhibits norepinephrine reuptake with minimal histamine and muscarinic receptor blockade, which reduces drowsiness, dry mouth, and constipation. In contrast, drugs like amitriptyline and imipramine have strong anticholinergic and sedative properties, often poorly tolerated in older adults. Therefore, desipramine offers a better side effect profile for this patient group. Question 2. Mrs. Thompson, aged 67, has chronic neuropathic pain and insomnia. Her clinician prescribes a low dose of nortriptyline. After 2 weeks, she reports orthostatic dizziness. Her blood pressure drops from 130 over 80 mm of mercury supine to 90 over 60 mm standing. Which pharmacological property of tricyclic antidepressants is most important in explaining this adverse effect? Option A, alpha-1 adrenergic receptor blockade. Option B, inhibition of serotonin reuptake. Option C, inhibition of norepinephrine reuptake. Option D, stimulation of presynaptic alpha-2 receptors. Option E, potentiation of histamine H1 receptor activity. The correct answer is option A, alpha-1 adrenergic receptor blockade. The explanation is that tricyclic antidepressants block postsynaptic alpha-1 adrenergic receptors in vascular smooth muscle, leading to vasodilation and a drop in blood pressure upon standing. This mechanism explains the common side effect of orthostatic hypertension, particularly in elderly patients. The inhibition of serotonin or norepinephrine reuptake contributes to antidepressant effects, not to this hemodynamic reaction. Therefore, alpha-1 blockade is the key pharmacological mechanism responsible for the patient's dizziness and postural blood pressure fall. Question 3. Mr. Jackson, aged 30, has obsessive-compulsive disorder, also known as OCD. His psychiatrist considers a tricyclic antidepressant with strong serotonergic activity. Which of the following drugs would be most appropriate? Option A, desipramine. Option B, nortriptyline. Option C, clomipramine. Option D, amitriptyline. Option E, doxepin. The correct answer is option C, clomipramine. The explanation is that clomipramine is the tricyclic antidepressant with the strongest serotonin reuptake inhibition, making it particularly effective in treating obsessive-compulsive disorder. Its potent serotonergic activity distinguishes it from other TCAs that are more noradrenergic in action, such as desipramine or nortriptyline. Although selective serotonin reuptake inhibitors are first-line treatments, clomipramine remains an established option for refractory cases. Its serotonergic profile directly addresses the pathophysiology of OCD, which involves dysregulation of serotonin pathways. Question 4. Mrs. Harris, aged 52, has treatment-resistant depression and is being managed with clomipramine. After initiating the drug, she experiences sexual dysfunction and sedation. She wants to know whether switching to a newer antidepressant may reduce these effects. Which of the following antidepressants is least likely to cause both these side effects? Option A, paroxetine. Option B, sertraline. Option C, bupropion. Option D, mirtazapine. Option E, escitalopram. The correct answer is option C, bupropion. The explanation is that bupropion acts primarily as a norepinephrine and dopamine reuptake inhibitor, with minimal effects on serotonin. This mechanism means it is far less likely to cause sexual dysfunction or sedation compared with serotonergic agents like SSRIs or TCAs. In fact, bupropion may even improve sexual function in some patients switched from serotonergic drugs. While mirtazapine can cause sedation and weight gain due to antihistamine activity, bupropion's activating profile avoids both sedation and sexual side effects, making it the best alternative here. Question 5. Mr. Davis, aged 55, presents with severe depression. His clinician decides to start a tricyclic antidepressant. All of the following statements about TCAs are correct except Option A, they inhibit reuptake of serotonin and norepinephrine. Option B, they can cause cardiac arrhythmias in overdose. Option C, they are safe for use in patients with recent myocardial infarction. Option D, they exhibit anticholinergic and antihistaminic properties. Option E, they have a narrow therapeutic index. The correct answer is option C, they are safe for use in patients with recent myocardial infarction. The explanation is that tricyclic antidepressants are contraindicated in patients with recent myocardial infarction due to their cardiac conduction effects, which can provoke arrhythmias and worsen post-infarct recovery. Their sodium channel blockade prolongs QRS and QT intervals, increasing the risk of fatal cardiac events in overdose or vulnerable patients. The other statements accurately describe their pharmacological actions and safety profile. Because of these cardiac risks, clinicians avoid TCAs in individuals with cardiac disease and prefer safer alternatives like SSRIs. Question 6. Mrs. Williams, aged 70, has depression and chronic insomnia. She is prescribed doxepin due to its sedative properties. She later develops confusion, orthostatic hypertension, and falls at home. Which of the following factors most likely contributed to her increased susceptibility to these adverse effects? Option A, reduced hepatic metabolism in elderly patients. Option B, induction of CYP3A4 by doxepin. Option C, increased renal clearance in geriatrics. Option D, enhanced GABergic neurotransmission. Option E, reduced sensitivity of postsynaptic receptors. The correct answer is option A, reduced hepatic metabolism in elderly patients. The explanation is that elderly patients often experience reduced hepatic metabolism, leading to decreased clearance and higher plasma concentrations of tricyclic antidepressants like doxepin. This increases the risk of adverse effects such as confusion, sedation, and orthostatic hypertension. Age-related pharmacokinetic changes amplify drug sensitivity, especially for medications with strong anticholinergic and sedative effects. Therefore, lower doses or alternative agents are preferred for older adults to minimize these risks. Question 7. Mr. Carter, aged 42, presents with chronic neuropathic pain. His physician considers using a tricyclic antidepressant due to its analgesic benefit. Which of the following TCA agents is most appropriate for neuropathic pain due to its balance of efficacy and tolerability? Option A, amitriptyline. Option B, nortriptyline. Option C, desipramine. Option D, imipramine. Option E, clomipramine. The correct answer is option B, nortriptyline. The explanation is that nortriptyline offers an optimal balance between analgesic efficacy and tolerability for neuropathic pain. It retains potent norepinephrine reuptake inhibition, which is key for pain relief, while producing fewer anticholinergic and sedative effects than amitriptyline. Desipramine may be less sedating but can be less effective for pain in some cases. Hence, nortriptyline is frequently chosen as a first-line tricyclic for neuropathic pain management. Question 8. Ms. Foster, age 29, is 10 weeks pregnant and has a history of major depressive disorder well controlled on amitriptyline. She is concerned about potential teratogenic effects and effects on lactation. Which of the following statements regarding TCA use in pregnancy and lactation is not accurate? Option A, TCAs cross the placenta and appear in breast milk. Option B, neonatal withdrawal may occur after in utero exposure. Option C, TCAs are considered absolutely contraindicated during pregnancy. Option D, nortriptyline may be preferred if therapy is continued. Option E, monitoring for neonatal sedation is recommended if used during lactation. The correct answer is option C, TCAs are considered absolutely contraindicated during pregnancy. The explanation is that tricyclic antidepressants are not absolutely contraindicated during pregnancy, although they should be used with caution. Available data suggest no strong evidence of teratogenicity, and certain TCAs, like nortriptyline, are preferred if continuation is necessary. TCAs do cross the placenta and may cause transient neonatal effects such as withdrawal or sedation. Careful monitoring is essential during late pregnancy and lactation to minimize infant exposure and adverse outcomes. Question 9. Mr. Murphy, aged 38, presents with major depression and insomnia. His clinician is considering amitriptyline, nortriptyline, imipramine, clomipramine, and desipramine. Based on their pharmacological profiles, which of the following TCAs has the least sedating properties and is relatively more activating? Option A, amitriptyline. Option B, nortriptyline. Option C, imipramine. Option D, clomipramine. Option E, desipramine. The correct answer is option E, desipramine. The explanation is that desipramine is the least sedating and most activating of the tricyclic antidepressants due to its minimal histamine H1 receptor antagonism. It mainly inhibits norepinephrine reuptake, promoting alertness and energy rather than sedation. In contrast, amitriptyline and doxepin have strong antihistamine properties, making them highly sedating. Therefore, desipramine is preferred when daytime drowsiness must be avoided. Question 10. Mrs. Turner, aged 49, with major depressive disorder, is on amitriptyline 100 mg nightly. She presents with wide QRS complexes and ventricular arrhythmia after a suspected overdose. Which of the following interventions is most appropriate for the management of this acute TCA toxicity? Option A, administering sodium bicarbonate intravenously. Option B, inducing emesis immediately. Option C, giving activated charcoal beyond 12 hours post-ingestion. Option D, administering beta blockers to control arrhythmia. Option E, enhancing renal elimination using forced diuresis. The correct answer is option A, administering sodium bicarbonate intravenously. The explanation is that intravenous sodium bicarbonate is the treatment of choice for tricyclic antidepressant toxicity presenting with cardiac conduction abnormalities. It counteracts the sodium channel blockade caused by TCAs, narrowing the QRS complex and stabilizing cardiac membranes. Inducing emesis is contraindicated due to aspiration risk, and forced diuresis does not enhance TCA clearance. Sodium bicarbonate therapy improves both arrhythmias and hypertension in severe cases of TCA overdose. Conclusion. That wraps up our revision on tricyclic antidepressants, TCAs, a crucial class of drugs in understanding the pharmacology of depression and related mood disorders. I hope this quiz helped reinforce your knowledge and clarified key concepts about their mechanisms, side effects, and clinical uses. For deeper study, I recommend referring to Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, for up-to-date prescribing guidance. These sources provide excellent explanations and clinical context that will strengthen your grasp of antidepressant pharmacology.